Hey guys, it's Dr. Hub. Today let's look at the vacuum delivery and the indications and the contraindications. So first let's move on to the indications. So in terms of the indications of the vent house, we are dividing it into the therapeutic and the prophylactic. So in terms of the therapeutic, what do we have? In therapeutic, there is the fetal distress in the second stage. In terms of the fetal distress, so this fetal distress, and this is in the second stage. Next is in terms of the maternal distress. So in terms of the maternal distress, and this will also be in terms of the second stage. Then comes the prolonged second stage. In terms of the prolonged second stage. So what are the other therapeutic indications? In terms of the deep transverse arrest, so in terms of the deep transverse arrest, so in terms of the deep transverse arrest, and also in terms of the persistent occipito-posterior. So in terms of the persistent occipito-posterior. Then even in cases of the high vacuum for the second twin, in terms of the high vacuum, and this is nothing but for the second twin. Now let's look at some prophylactic indications. So in terms of the prophylactic indications, there is the preeclampsia. So the preeclampsia, as well as there is the VBAC and also the cardiac defects. So in terms of the cardiac defects, in terms of preeclampsia, in terms of the anemia. So all these cases, the vent house is indicated. That is, it can be used. Now let's look at some contraindications of the vent house. The contraindications of the vent house is in terms of the preterm head. In terms of the preterm head is where we don't use this vent house. Next, in terms of the phase presentation. So in terms of phase presentation, then in case of the fetal coagulopathy, and in terms of the fetal blood sampling. So in terms of preterm head, phase presentation, fetal coagulopathy, as well as in terms of the fetal blood sampling.